Hey everyone, and welcome back to What After Dentistry. I hope you guys have watched our previous video wherein we discussed about the course requirements for the three fields that we have been talking about: hospital management, public health, and health informatics. In today's video, I'm going to walk you through the opportunities and the work profile that is offered in these three fields so that you get a fair idea of what actually you are landing into. Now, before I move ahead, as I always say, please subscribe to the channel as it's absolutely free. So please subscribe. That's my humble request. Now, if you remember in the previous video, I gave you a small tip on how you can identify the course prospects from the current students or the recent alumni of any college using LinkedIn. In today's video also, I'm going to give you a small tip in terms of how you can verify and validate that your chosen field is in line with your personality. So watch the video till the end. Now moving ahead, let me share my screen with you guys so that I can walk you through the through the opportunities, the work profile, what exactly these fields are all about. I have created a presentation for you guys so that I do not miss out on any points. Just give me a moment. So let's start with the first parameter, which is what is the field about? So hospital management basically it refers to the administration and management of healthcare facilities, including hospitals, clinics, and any other healthcare facilities. Like in the public hospitals, we have 5 levels of hospitals. Similarly, in private sectors, there are nursing homes, there are small polyclinics, there are clinics, there are small 20-25 bedded hospitals. So all of these areas, managing these hospitals is what hospital management is all about. So based on the department, the task you can be involved, it may include budgeting, it may include staffing, patient management, quality control. These are all, majorly if I have to bucket into two areas, this is hospital operations and quality, management of the hospitals. So hospital management professionals, they are responsible for overseeing the day-to-day operations of the hospital, as I mentioned, as well as developing and implementing policies and procedures to ensure the facility runs smoothly and efficiently. They also work closely with medical staff, including doctors and nurses, to ensure that patients receive high quality care. So it's always, when you talk about hospital management, it's basically managing the holistic, management of healthcare facilities of hospitals where the curative or the medical treatment is provided to the patients. Then talking about the public health management basically refers to the design, organization, and implementation of the programs and policies which is aimed at improving the health of a population. So here it's not individualistic curative treatment that you're actually providing. It's more onto preventive and promotive health that we talk about towards the community at a large. So here it's community at a large that you are focusing on. This you're focusing more on the hospitals per se, on the healthcare facilities per se. This can include activities such as health programs implementation, such as maternal health, immunization, NCD, disease surveillance, health promotion, emergency preparedness like we saw in COVID, and many more. This field also requires an active engagement with community partners to identify key challenges related to accessing healthcare and its equitable distribution, which calls for implementing evidence based interventions to improve health outcomes. So that's what public health is all about. It's more focusing into community at large, population at large. In some of the countries, it is also called as population health. So here, basically, you're focusing more into preventive, promotive aspect of health rather than curative. And then talking about digital health or health informatics. Now, digital health, you need to understand it's like a big umbrella of where you're trying to integrate or amalgamate healthcare and technology together, right? That's one big umbrella. And under digital health, you might have different areas. So, health informatics is one part of digital health. Nursing informatics is again one part of digital health. Public health informatics, then you have medical devices, which we also call as Internet of Things or Internet of Medical Things. All these are one big part of digital health. So as of now, we do not have courses per se like Master of Science in Digital Health or Master course in Digital Health. That is not available. As of now, we basically have Separate courses like health informatics is one, then nursing informatics is another, bioinformatics is another. So we all for all of these streams we have master courses available. So basically, as I mentioned, digital health is the amalgamation of health and technology, where the focus lies on building, customizing software applications for healthcare, such as electronic health records, telemedicine, and remote consultation applications, mobile health applications, which can be, very exhaustively, you can use it in the chronic disease management person. There are various other aspects also. It also encompasses the areas of Internet of Medical Things, IOMT as we call it, which focuses on design of self-care devices such as wearable bands, mobile apps for chronic conditions, glucometers that we have, digital glucometers, digital weighing balances, all these are part of medical devices. This field requires doing activities related to business analysis, software customization and configuration, quality assurance, system implementation, and technical support. So, these are some core areas where you will be working as a digital health expert or as a health informatics professional. The second parameter is the skills that are required to grab the opportunities. Now, when I talk about hospital management, as I mentioned before, since it is basically talking about healthcare facilities, it's about managing day to day operations of a hospital, the quality aspect of the hospitals. Hence, you should be well aware about the operations part. You should be well about the quality, how to maintain quality in hospitals, what are the various accreditations or what are the legal requirements, regulatory requirements to basically ensure that you have the quality parameters in line. Marketing, many of the students, like somebody who's coming say from a non-healthcare background, for example somebody who's done DDA in like a general management and now they want to specifically do masters in hospital management. So people like these who are coming from their undergraduation is not from a medical or a healthcare background, they basically can work into the business aspect of the hospital. See, at the end of the day, hospital is also a business, right? So how to run that business, the marketing aspect of it, the like for example human resources, the financing part of it, one can get into these areas also if you have an interest. So marketing, healthcare, finance, these are all the business aspects of healthcare facility which you can always get into. For public health, it is more important to understand what happens at the population at large. So understanding the health programs, understanding the healthcare system in India, if you're doing this course from India or if you're pursuing it say from abroad, you should know the healthcare system of that country in depth. Data analysis, interpretation skills, health policy, health financing, etc. So these are some of the skills or areas that you should be well aware of. And then talking about health informatics, business analysis, the basics of business analysis is very, very important for you to know, because if you get into product development, you should know how to write use cases, you should know how to write software requirement specifications, how to create workflow diagrams, what are the industry standard tools that are being used, what are wireframes, what are mockups, all of this basic information of business analysis, you should have that understanding. Then analytical and interpretation skills, if you get into data part of it. So now healthcare is huge, right? We have so much of data being generated on day-to-day basis. So how to analyze this data, what goes into data analysis, all of those aspects you should be well aware of. Quality assurance of the systems, of the softwares that are being developed, understanding of system design and implementation practices, change management, etc. So these are some of the areas which are very important from the health informatics perspective. Now, many of you also come up and say that in health informatics, do I need to know coding? Now, let me tell you, if you also start learning, if you start learn the coding, the code or the programming language that is written to basically develop a software, then why do we need a developer? Okay, so our role coming from a healthcare or a even non-healthcare background and getting into management aspect of health informatics is not to develop a software, is not to code the software. No, that's not our job. So it is absolutely not required for you to learn the programming language. Yes, some basic skills of SQL is, again, SQL is a programming language, but just a basic aspect of it, like join function and or function, all of these functions, which are very, very basic functions. How you write a query in SQL. If you want to say generate a report or you want to generate some statistics from the software. These are very basic, which are already taught when you do a master's program, right? So basic skills of database management and basics of SQL. These are the two main technical aspect I would rather, put it as, if you really want to understand. And these are always taught as a part of your master's course. Apart from this, if you are expecting, you want to learn HTML, or you want to learn CSS, or you want to learn Java, that is not required at all, because you will not be coding the systems. You are not required to code the system. The system, either are required to understand the requirements, what will go in the system, or if you have a ready system, how will you implement it at the on-site. So these are the two areas where you will be working exhaustively as a health informatics professional. Apart from these hard skills, soft skills like being a problem solver, good communication, good behavior, adaptable nature, good team player, these are all some very basic soft skills that are required for you uh, if you want to grow in your career. Again, when you pursue management, you do have these personality developments or soft skill classes that are given to you as guest lectures when you pursue any of these master courses. Then the third parameter is organizations where you can work. So when you pursue hospital management, it's not just hospitals where you will be working, but you can also work with hospital consultancies. There are many organizations which work into providing consultancy. So say suppose I want to set up or establish a new hospital, even if it is a 20 bedded or a 25 bedded, and I want to run that hospital, I want to set up that hospital. I need to have some form of guidance in terms of, how am I going to do the hospital planning, what kind of legal requirements are required, what kind of licenses I need to run in my I need to run my hospital. Then what are the accreditation bodies that I can look into. So all of these things, I would like to know if I want to set up a hospital. So these consultancies, they basically help the hospitals to, if they are trying to set up a new hospital, or if someone is trying to expand their hospital, existing hospital. So these are those consultancies where you can work. Again, financing is also a part of these consultancies. They also work into the hospital financing aspect. Then you can also work with health insurance companies. So they also need people who come from this hospital management background. It's more into managing the claims and processing the claims and all of those aspects, right? Making sure that the turnaround time is proper, or it is as per the set guideline. Medical tourism companies, as we all know, India is a hub of medical tourism. Here, again, many organizations work into these aspect wherein they make sure that the patients who are coming, international patients who are coming, they are being routed and they are being provided the treatment in a proper channel. So either you can become a medical tourism first facilitator, or you can work into these organizations. Even you can also work in the medical tourism department of a hospital. Then research organizations and academics, again, these are areas. If you want academics, if you want, you will eventually have to do a PhD, say after 5 years or 6 years, 7 years down the line. If you want to get into academics, you will always need to do either a research fellowship or a PhD. Then for public health, you can work with NGOs, you can work with CSR wing in corporates, which is the corporate social responsibility. There are various public health organizations you can work. Then we have also global health organizations like UNAID and UNICEF and WHO, all of these organizations. You can work with ministries at various levels, state, district, and center. Academics and research, that's always open. So public health, there are a lot of researches that are being done at a population health level. So you can basically get into these researches if you want, and then you can work exhaustively with these research organizations. Then talking about health informatics, you can work with IT department in the hospitals. You can work with organizations like work in public health informatics. For example, you have HISP India, that's one of the organization which works exhaustively into public health space. Then there are other organizations, I'm not very sure of the name. I'm just forgetting the name, but HISP India is one where you can, if you want to get into public health informatics, they work exclusively into this area. Then health tech companies, there are many health tech companies that are coming up, and which are already there. Health insurance companies, again, because they also have health IT component. Ministry of Health at various levels, which is the digital health department. Usually you have a digital health like NH here in India. At the central level, we have NHA, which is National Health Authority. which is basically focusing into the Ayushman Bharat digital mission. So they exhaustively work into this space, and they do have a lot of requirements. You can go on to NHA website and you can get understand what are the opportunities, and you can apply for those. Again, research and academics is one area if you want to get into uh, um, later on, maybe 3 years, 5 years down the line, if you want to get into academics. For academics, research exhaustive, if you want to, build your portfolio, you will have to pursue a PhD or at least a fellowship, research fellowship program, any of these two, to build your career into academics and research. And then the work profile which is offered in majority of the cases, and this might differ, I'm not saying that this is 100% the same thing, but at least 70 to 80% of the cases, this is the kind of work profile that will be offered to you. So when I talk about hospital management, the nature of job, that is 80 to 90%, it is a desk job. So you will not be required to go places to places and do your stuff, but you will be basically, you are entitled, or you are basically sitting at one place and you're doing your job. So it's 82% desk job that is given. And the major area of work is revolving around the management aspect. So it can be quality, it can be operations, it can be any other, departmental management, whatever it is, but it is focusing majorly on the management aspect. Talking about public health, the nature of job, be ready if you're pursuing public health. 70% of the times you will be on the field, at least initial years of your life, 2 to 3 years of your life, you will be required to be on the field. So 70% of the times you will have travel related work coming up, and 30% you will have a desk job. And as I said, initially your 2 to 3 years, make up your mind that you would have to do a lot of field work to finally get your desired, like one, if you want to just sit at one place and work, that will only happen after 3 to 4 years of timeline. But majority of the times, yes, even after 5 years of the work profile, you will be required to travel, because public health majorly focuses on states where, like if you know the empowered action group states that we have. So where actually public health is required, you will be required to work. For example, say you work with a CSR wing of any corporate, right? Now this CSR wing, they are providing nutrition, if they focuses on the nutrition part of it, or they say focus on the child health or maternal health, and their focus area is not, if you're working in Delhi NCR region, they might be providing their services, say, in some other north state of North India, maybe Uttar Pradesh or maybe Bihar. So if you are basically their services are provided in these states, you will be required to travel to these states. So for public health, 70% travel and 30% desk job. Initially, this is how you will be starting. Eventually, depending on how you grow, where you grow, totally depends on you. And then digital health or health informatics, again, the nature of job is 50% travel and 50% desk job, even if it is in the same state. So, for example, if you are working with an organization which is based in Gurgaon, obviously the organization is developing a software, say, for hospitals or maybe for clinics or any healthcare facility. They are not developing software for themselves, right? So, in a hospital, their hospital can be either Gurgaon based hospital, it can be a Delhi based hospital, it can be a Faridabad based hospital. Within that Delhi NCR region, whichever hospital they are basically trying to provide their service or their product to, you will have to travel to that hospital to understand what are the requirements. Or if the product is ready, you will have to go on site and help in the implementation support part of it. So yes, 50% travel, 50% desk job, and nature of work will always revolve around technology. So if you're good with technology, you feel that you don't have that technology fear, which most of the medical doctors, people from the medical and dental stream, they have. If you're not, if you don't have that fear of technology and you are well aware that yes, I can handle technology, you can definitely get into this field. So that's it, guys. I try to give you as much as information possible. I know the video has gone a little longer, but I wanted to provide all this information so that you have a very clear-cut idea in terms of what these three fields are all about and which are the organizations that you can work with. What is the kind of work profile that you will be offered, at least initially. Eventually, 3 years, 4 years down the line, totally depends on how you grow in the field or what are the area of what is your area of interest in a particular field and how you would like to grow further. So you can always make a wise decision. by undergoing a personality test. Remember, I mentioned about the small tip at the beginning of the video. So, this is that tip. I will recommend if you guys can undergo a small personality test, which is by the name of Myers-Briggs personality test. This personality test gives you 16 list of 16 personalities, which are unique to each other, and they are basically created with a combination of some traits and behavioral tendencies like being an introvert, extrovert, observant, thinker, communicator, etc. So this is it's a free test. If you just type in Google Myers-Briggs test, you will get a list of all the websites that would be providing this test. The one that I follow is 16personalities.com. So you can go onto that website and you can just type in the just to get that test done. It'll take, I think, 10 to 15 minutes for you to complete the entire questionnaire set. And it gives you a very detailed, if not a detailed, at least summary of what your personality is. So it helps you to understand what your personality is, and then eventually you can see that which area you fit into. So by identifying this personality test and by asking the course prospect from the current students or the alumni, recent alumni of a particular college, from using LinkedIn, you can always make a wise decision in terms of whether you want to get into hospital management, public health, or health informatics. If you like this video, please give it a thumbs up, share it with your colleagues and friends. Before I end, as a special offer for all our viewers, we are conducting a webinar on pathways in health informatics. This webinar will help you to understand what the field is all about, and I will also try to give you a roadmap of how you can grow into this field. So if you want to join the webinar, please join our WhatsApp group, the link to which is given in the description. The webinar will be hosted on coming Saturday, 11th February at 7 p.m. IST. So what are you waiting for? Take action, join the group. I will see you in the next video. Until then, bye and good luck.